If you get upper outer thigh pain when you're walking, then this video is for you. I'll explain what causes upper outer thigh pain when you're walking, plus share some tips to help you walk more comfortably. Now, as a physical therapist, there are typically 4 things that I look at when evaluating a patient. Joints that can cause pain in the area, muscles that can cause pain in the area, nerves that can cause pain in the area, as well as things that may be non-musculoskeletal and outside of my scope of practice. But let's start with joints that can cause thigh pain when walking. And the primary joint is your hip joint. Now, many people think their hip joint is this bump on the outside of the hip, but your actual ball and socket joint of the hip is located in the groin. And so if you're having hip joint pain, such as from arthritis, you typically feel it in the top front part of your thigh, not right over that bump or greater trochanter on the outside of the hip. Now, the reason that people get groin pain or thigh pain when they're walking is as you lose cartilage in the hip joint socket, the joint surfaces get closer together and start to rub on one another as you move back and forth while weight bearing over the joint. Now, your hip joint is in the most closed packed position when your thigh is either flexed all the way, internally rotated all the way, or adducted or crossed across this way all the way. Now, if you have weakness in your glute muscles, then as you put pressure on your leg when you're walking, your hip drops down like this. And that puts you in a relative position of hip adduction, where it makes the joint space a little bit smaller. Furthermore, if you have weakness in your external rotators in the back of your hip, your knee can come inwards, causing internal rotation of the thigh, which again minimizes the joint space. And so the best way to relieve hip joint pain when you're walking is by activating your gluteal muscles more. An easy way to practice doing that is just standing on one leg. And you'll squeeze the muscles in your buttock, kind of clench your butt cheek, and then lift your other leg up off the floor. Now, you want to try to keep your pelvis as level as possible, so it helps to do this in front of a mirror where you can see if you're dropping out to the side like that, or if your knee's coming inwards like that. Squeeze the glute muscles, try to slowly load pressure over that leg, and then work up to holding for 10 seconds. The ability to stand on one leg for 10 seconds or longer decreases your fall risk and is also statistically related to a longer life expectancy. So balancing on one leg is a good way to relieve thigh pain from hip joint arthritis. But you do need to continue that into your daily activities as well. So if standing on one leg is good for a short period of time, then you want to be able to activate those gluteal muscles each time that you take a step when you're walking. So as you put your foot on the ground, think about clenching your gluteal muscles, then squeezing the other side, then squeezing the other side, and then squeezing the other side. Sometimes it is a little bit hard to think about both sides at once. So if you have one hip that's more painful, start with that, and if you need to, progress to the other hip. So that's the joint causes of thigh pain when you're walking. The next category is muscular causes of thigh pain when you're walking. And there are several muscles that can cause thigh pain, but particularly your quadriceps and your hip abductor muscles. Your quadriceps are made up of 4 heads, hence the name quadriceps, and 2 of the heads primarily cause this upper outer thigh pain. One of those is the vastus intermedius. It's deep and lies underneath the rectus femoris, which runs across your hip and across your knee. The other 3 muscles besides the rectus femoris do not cross the hip. So the vastus intermedius is deep to the rectus femoris, and it has a finger-like pattern of pain like this, down the front and outside of the thigh. The other muscle that's often involved with thigh pain when walking is the vastus lateralis. It has a referral of pain down the outside of the leg, and it may get misdiagnosed as IT band syndrome. But most of the time, IT band syndrome is actually more or less trigger points in the vastus lateralis, which lies underneath the IT band, and so you can have trigger points on the front or back. Alternatively, IT band syndrome can also be due to trigger points or stiffness in the tensor fasciae lata, which is the next muscle that we'll talk about. The tensor fasciae lata is a short little muscle that attaches into your IT band. And your IT band is basically a long, thick tendon or piece of fascia. You cannot stretch it, and you wouldn't want to stretch it. But you can stretch that tensor fasciae lata, which often becomes stiff. The tensor fasciae lata flexes the hip, abducts the hip, and internally rotates the hip. It's one of the muscles that helps you to balance on one leg, the exercise we were talking about earlier. But it's counterbalanced by your gluteal muscles. So the tensor fasciae lata is an internal rotator of the hip. The gluteal muscles, particularly the posterior fibers or back fibers, externally rotate the hip. And so as you're standing on one leg, if your glutes are weak, you'll tend to use that tensor fasciae lata more, which can cause the knee to twist inwards. So that again brings us back to the first exercise, where standing on one leg, squeezing your glute muscles, and balancing on one leg can also help hip muscle problems if you're having trouble with your tensor fasciae lata being too stiff and tight, or your gluteal muscles being too weak. And by the way, your gluteus medius and gluteus minimus right here that lie just over top of the hip bone can also refer pain down into the outer thigh when you're walking. Now, it's very difficult to stretch your quadricep muscles other than the rectus femoris. I mentioned that rectus femoris crosses both the hip and the knee, and so it's very easy to stretch the rectus femoris doing a stretch like this. But the other three quadricep muscles only cross the knee, and so to stretch them, you would have to bend your knee maximally. Now, most people will either get limited by approximation of their hamstrings and their calves, where they come together before the muscle gets on its entire stretch, or maybe you have some knee pain or knee arthritis where you bend to a certain point and your knee just starts to hurt and it won't let you bend all the way to where you get to stretch those muscles. So what do you do if you have a muscular cause of thigh pain when you're walking that's coming from either that vastus intermedius or vastus lateralis, and you can't stretch it all the way? Well, this is a situation where I'm a big fan of massage guns. Massage guns can help loosen up the tighter, stiff tissues without having to take the muscle to its end range. So this one here is the Bob & Brad X6 Pro Max. I've tried out a lot of different massage guns, and this one actually is one of my favorites. The reason that I like this one so much is that it has this metal head, and this works really well for me because I do have a little bit denser thigh muscle. And I'll show you how it works here. You turn it on by holding down this button in the back, and you'll see that one light lights up here on the gun. It actually has 5 different speeds, going to a maximum of 3,200 revolutions per minute, so it can get going pretty fast. Just use the speed that feels most comfortable for you. But this works really well, especially for that vastus intermedius. Remember, it's a deep muscle. It lies underneath the rectus femoris. So you have to get down a little bit deeper into the muscle to actually get to that vastus intermedius. Just hold pressure for about 10 to 30 seconds on each spot where you find a tender spot or a trigger point, and then move on to the next. You can kind of scan around and see what feels a little bit sore or tight, and then if you find somewhere that feels sore or tight, hold pressure on it. Again, with the vastus lateralis, you may have trigger points either in front of the IT band or behind the IT band. And so just move around to where you find those trigger points. And using this gun for a couple minutes can be really helpful if you have knots or trigger points in your thigh muscles. I'll show you a couple other things about this one that can be helpful for this type of problem. If you take this metal head off here, and the next one that I really like is a heated head. You can do sort of a heated massage with this. This actually has heat and cold settings, but the coldest one only gets down to about 50 degrees Fahrenheit. So it's not as cold as ice. And truly, if you've got something that needs to be ice that's inflamed, you probably don't want to beat it with a massage gun anyway. However, there is the heated version that I do like this one. There's both a medium heat and then a high heat, which goes up to 113 degrees Fahrenheit. You just push this in, and it actually already is getting pretty warm. So it doesn't take long for this to heat up. You just turn it back on like before, and you can do kind of a heated massage to the muscles, which also feels pretty good. Now moving on to the outer hip muscles. For this, these are smaller muscles. Your tensor fasciae lata is right there. Your gluteus medius and gluteus minimus are right there. And then your hip external rotators are a little bit farther back yet. So for this, I like to use a little smaller attachment, a little trigger point attachment. And then you can do this kind of sitting off the edge of the bed like this. You don't have a lot of weight bearing on this leg. You want it to be no pressure where these muscles are relaxed. So just kind of touch your toes down and then put a little pressure. Your tensor fasciae lata is going to run right off the bump on the front of your hip. So kind of come to that hip bone or bump on the front of your hip. Between the bump on the front and the bump on the side, that's generally where your tensor fasciae lata is. So hold a little trigger point pressure there on the tensor fasciae lata. You can move back to the gluteus medius and gluteus minimus. They're right over top of that bump on the outside of your hip. So if you hold the pressure right over the outside of the hip, you can release some of the trigger points or knots in the gluteus medius and the gluteus minimus. And then if you want to get back to your piriformis or hip external rotator muscles, they're just a little bit farther back this way in your buttock. After you've used the massage gun, next it's time to stretch the stiff muscles. I mentioned before that the quadricep muscles are kind of hard to stretch, but the tensor fasciae lata is relatively easier to stretch. Primarily, you would stretch it just by doing a normal hip flexor stretch, where you roll your pelvis underneath like this, keep your spine nice and neutral, and then push your hips forward until you feel a stretch in the front of the thigh. You don't want to allow your back to arch like that, so keep the pelvis rolled under, squeeze your glutes, push the hips forwards like that. Now to get to the tensor fasciae lata, it is actually a hip flexor, but it sits more on the outside of the hip. So to target that a little bit more, just slightly press your hip out to the side once you get into that hip flexor stretch, and that will bias the tensor fasciae lata more than the other hip flexor muscles. Now, I really like to do this in a kneeling position. Some people may not be able to do this due to knee pain, but if you are able to kneel, that also puts your rectus femoris, another hip flexor, on stretch, which is also a quadriceps muscle. So the mechanics would be the same, rolling the pelvis underneath and pushing the hips forward, and then slightly push this hip out to the side. You may have to turn your other knee that way to get this one to go out to the side. But just go till you feel a little stretch on the front outside of the hip, and then ideally hold this for a minute if you're able to. An alternative variation of that, if you're not able to kneel, is the standing version that I showed before. But I want to show it from the front so you can see the angle a little bit better. Roll the pelvis underneath like this, push the hip out to the side, and then turn the knee out that way. That way you get hip extension, and then you also get slight adduction to stretch the tensor fasciae lata more. Now the gluteus medius and gluteus minimus you don't actually want to stretch because they are typically weak, and further overstretching those muscles can actually lead to worse hip pain. So we discussed joint causes, we discussed muscle causes. The last thing we'll discuss is nerve causes. If you have thigh pain in the outside or back of your thigh, that's often due to a problem with your sciatic nerve. That may be either compressed in the hip or buttock, but more often it comes from the nerve roots in the lower back, L4, L5, and S1. Furthermore, if you have a burning pain on the front outside of your thigh, that's a condition known as neuralgia paresthetica. And that's caused by an irritation of the lateral femoral cutaneous nerve, which is made up of the L2, L3, and L4 nerve roots in your spine. Now, if you'd like to learn tips to help out with those problems, you can check out this video on neuralgia paresthetica or my back pain and sciatica playlist down here. But before you go check those out, if you found this video helpful, Make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.